Hello, friends. We are once again with the new topic of the GIT, that is the gastrointestinal bleeding. Right? Let's see what are the objectives of the today's session. So, after the completion of the today's session, you are able to define the what is the gastrointestinal bleeding, which are the source of GI bleeding, which are the causes and the mechanism of the GI bleeding, clinical approach, history taking, differentiation of the upper gastrointestinal bleeding versus the lower gastrointestinal bleeding. Uh, what are the assessment and evaluation in this case, and what are the management as well as the homeopathic therapeutics. So let's see what is the definition of the gastrointestinal bleeding. So gastrointestinal bleeding refers to any bleeding that occurs into the gastrointestinal tract from mouth to the anus. So as you all know, the gastrointestinal tract is a start from the mouth and end into the anus. So you know that any bleeding you found from the mouth to the anus, which we consider that a gastrointestinal bleeding. Remember one thing, it is not a disease but a symptom of the various underlying condition, right? So I hope you can easily understand what is the definition of the gastrointestinal bleeding, right? Let's see what are the different sources of the GI bleeding, right? So sources are based into the anatomical location, and the GI bleeding is the classified as two part. First, upper GI bleeding, which is known as a UGIB, and the lower GI bleeding, which is called as a LGIB. So upper GI bleeding is up to a stomach considered into the upper GI bleeding, and the intestine and the colon and the rectum, which consider as a lower GI bleeding. Right. So let's see one by one. In upper GI bleeding, sources are esophagus, stomach, and up to duodenum, right? And into the lower GI bleeding, sources are jejunum, ileum, colon, rectum, and anus. So these are the site, these are the source where the bleeding occurs. So if up to a duodenum, it is called as a upper GI bleeding, and after the duodenum, jejunum, ileum, colon, rectum, and the anus, it is considered as a lower GI bleeding, right? Now, let's see which are the different causes of the upper GI bleeding. So, upper GI bleeding, आपको source पता है? अभी देखते हैं क्या क्या है causes. So, in the peptic ulcer disease, as well as into the gastric or duodenal peptic ulcer, esophageal varices, which are we seen into the common into the portal hypertension, into the cirrhosis of the liver, gastritis, esophagitis, malarious tear. In the vomiting, we already learned. So mucosal laceration at the gastroesophageal junction due to the severe vomiting, esophageal cancer or the gastric carcinoma, uh, dual falls lesion, that is the abnormal large artery into the stomach, and the drugs like severe NSAID, steroids, and the anticoagulants. In all these causes, in all these conditions, there is a risk to happen the upper GI bleeding. Now let's see what is the mechanism of the upper GI bleeding. Upper GI bleeding mechanism, first mechanism, when there is an ulcer, so mucosal erosion ulcer can causes the exposure of the blood vessels, which is induce the hemorrhage, right? And in the other mechanism, in the case of portal hypertension, So due to the portal hypertension, there is the variceal dilation of the arteries of the esophagus, and they ruptured into the esophagus, and it is considered as a esophageal varices, and the bleeding is a happen, right? Third one, when there is increased gastric acid and the pepsin, which is converted into the peptide ulcer, now they damage the mucosa of the stomach, and vessels erosion, just like a first mechanism. So all these three, all mechanism, there is a vomiting of the blood occurs, and we will call it the hematemesis, right? Now let's see what are the causes of the lower gastrointestinal bleeding, lower GI bleeding. So development of the diverticulosis, angiodysplasia, colorectal carcinoma, inflammatory bowel disease, hemorrhoids, anal fissures, and infectious colitis. In all these conditions, there is a risk to happen the lower GI bleeding. And let's see what are the mechanism of the lower GI bleeding. So vascular malformation or the friable mucosa, which result into the bleeding. Tumor invade the blood vessel and the bleeding occurs. Inflammation and the ulceration of the colonic mucosa, and the dilated rectal hemorrhoids are ruptured and the bleeding happens. So these are the different mechanisms which we found in the case of the lower GI bleeding. Now let's see what are the clinical approach we have to do in the GI bleeding in hematemesis or into the melena or the hematochezia, right? So let's see clinical approach. So first, we have to perform the initial assessment. We have to check for the shock, BP, and the pulse. We have to find what are the hemodynamic stability of the patient. Second, we have to perform the resuscitation if needed. If we have to give the fluid or the blood transfusion, if there is a massive hemorrhage is there. Then we have to take the focus history, physical examination. Then we have to localize the bleeding. Is this a upper GI bleeding or the lower GI bleeding? Then we can perform the investigation, then manage the case. So this is the steps of the clinical approach of the case of the GI bleeding. So let's see first history taking. In history check taking, we have to first ask about the color of the blood. Okay, what is the color of the blood? So if that is the hematemesis, means vomiting of the fresh blood, so cause may be from the upper GI. If it is a melena, means a black tarry stool, so the cause is a upper GI, means bleeding हुआ है और वो पूरा stool में निकलता है तब तक वो black हो जाता है. And last, that is the hematochezia, so that is the bright red blood per rectum. The cause may be a lower GI, right? Then we have to ask about the associated symptom also. So if that is the pain into the epigastric region, so think about ulcer. If there is a bleeding with the dysphagia, think about esophagitis. And if there is a melena with the tenesmus, think about a rectal pathology. If there is a weight loss and the altered bowel habit, think about any malabsorption disease, IBS or the IBD. Right? Apart from this color and the associated symptom, we have to take the more history. We have asked about drug history, any of the NSAID, non-steroidal anti-inflammatory drug, or any anticoagulant patient have took, and we have to ask about alcohol consumption to rule out the varices. We have to take the past history about the peptic ulcer, liver disease, or the IBD, and we have to take the family history also for the GI cancer or the bleeding diathesis. Now we move on the important topic in this session, that is the differentiation between the upper GI bleeding versus lower GI bleeding, right? So that is one table and easy to remember that. First, that is the presentation. Uh, in upper GI bleeding, it is the hematemesis, means vomiting of the blood, and second one, that is the melena, the dark cold terry blood present into the stool. And if there is a lower GI bleeding, there is a hematochezia, means a bright red blood is with the stool, right? Second one, that is the stool color. In upper GI bleeding, the stool may be a black and the cold terry, and into the lower GI bleeding, the stool may be a bright red color or the maroon color. We are talk about blood loss. In upper GI bleeding, the blood loss is a moderate to severe, and into the lower GI bleeding, the blood loss is a mild to severe. Common causes for the upper GI bleeding, they are the peptic ulcer and the esophageal varices, and into the lower GI, there will be a diverticulosis or the malignancy. Diagnostic test of the choice in upper GI bleeding, that is the gold standard choice, that is the GI endoscopy, and for the lower GI bleeding, that is the colonoscopy, right? Now let's see, after the differentiation, we can easily identify the source of the bleeding. Then we are doing the clinical examination. So in the clinical examination, we first do the general examination. We are talking the investigations. Mm. First, we perform the blood test. In the blood test, there is a CBC. Due to the bleeding, there is a low HB. Then after, we have to perform the coagulation profile. In the coagulation profile, we perform the investigation BT, CT, PT, APTT, and INR. Then we have to do the liver function test to rule out the cirrhosis of the liver and the other liver pathology. And in upper GI bleeding, there is the blood urea nitrogen BUN. It is elevated, right? So these are the first investigation, basic blood test. Then after the we move forward into the investigation, that is the endoscopic investigation. So with the history taking and the clinical evaluation, we found the source of the bleeding. If that is the upper GI bleeding, we have to do the upper GI esophageogastroduodenoscopy. And if we suspect the lower GI bleeding, then we have to perform the colonoscopy, and these are the visual aid. And this is the gold standard choice for the investigation in any gastrointestinal bleeding. Apart from this endoscopy, we have to perform the imaging study also. So if we have to found the active localization bleeding, then we have to perform the CT angiography. And from the CT angiography, we found what is the exact location of the bleeding. And the latest investigation, that is the tagged RBC scan, which is nuclear medicine. We can give the nuclear medicine on the RBC, and we can found from which area the bleeding is occurs. But it is a use into the minor bleeding, right? Other investigation, that are the stool examination. So we perform the stool investigation like occult blood and the parasites or the ova for the suspected in any infectious causes. So from the blood investigation to the stool examination, there are the different investigations are useful to find out what may be a cause of the gastrointestinal bleeding, either into the upper GI bleeding or into the lower GI bleeding. Now we move on the management part. In the management, we found first general management, then the specific management. So let's see, talk about the general management. So in general management, first we have to stabilize the patient, given the IV fluid, oxygen, and if there is a massive bleeding, we have to give the blood transfusion. Then we have to put our patient into the nil by mouth, NBM, हमें कुछ नहीं देना है. सिर्फ पेरेंटरल फ्लूइड के ऊपर पेशेंट को सर्वाइव करवाना है. Then we have to stabilize the monitor vitals. Every vitals को stabilize करना है. These are the general measure for the upper gastrointestinal bleeding or the lower GI bleeding, right? Now we move on the specific management for the upper GI bleeding. So due to the technologization, nowadays it is a very common endoscopic therapy are used. So for the perforated peptic ulcer, they are used the clipping and the cauterization. So that is the method when there is a skin is a burn with the cautery. If there are the varices, they are using the bending, and it is a very easy method, and compared to the surgery, it is a very affordable method also, non-invasive. So first choice, that is the endoscopic therapy for the upper GI bleeding. Second, these are the PPIs, so proton pump inhibitors. So we have give the IV pantoprazole. Then if the variceal bleeding is there, we can give the octreotide. This is the medicine for the variceal bleeding. And if endoscopic therapy is failed, then we have to do the open laparotomy and do the surgery for that. These are the specific management for the upper GI bleeding. Now let's see what are the specific management for the lower GI bleeding. So first, same like upper GI, we can perform the colonscopy and homeostasis vasoconstriction by the injection of the adrenaline, and we can do the cauterization also. We can do the angiographic embolization also when we perform the CT angio. At that time, we can perform the embolization also at the bleeding level. Third one, that is the surgery. So segmental reaction, if bleeding is a localized and uncontrolled, so segment को हम निकाल सकते हैं और उसकी surgery कर सकते हैं. So these are the management of the upper GI bleeding as well as the lower GI bleeding. I hope you can easily understand and you can remember what are the different management point we have to take the act into the manage upper GI bleeding and the lower GI bleeding. Now let's see what are the homeopathic therapeutics for the gastrointestinal bleeding. So the first, when you are deal with the homeopathic medicine, so you have to select the medicine on the totality, on what are the exciting cause, constitution, modality, and which is the type of the bleeding. So first drug, we are talking the generalized drugs. So first drug, that is the hemamalis. So in the MML is passive venous hemorrhage, the blood is a dark and the rectal bleeding, varicose veins are there. Second, that is the ipecacuanha, persistent nausea with the bleeding and the bright red blood, hemorrhagic tendency in the hemoptysis we can use. Third one, that is the phosphorus. So bleeding from the every orifices and the bright red and the profuse bleeding is there. Fourth one, that is the nitric acid, bleeding with the pain, rectal fissures and the bleeding piles is there. Fifth one, that is the Merck Sol. There will be a bloody diarrhea, tenesmus is a present, slimy stool with the blood is a present and it is a worse at the night. Sixth one, that is the aconite, sudden bleeding with the anxiety and it is a bleeding after the shock or the fright. Eighth one, arsenicum album, burning pain into the GI tract. Patient is a restless and that is the black stools is there, right? Other therapeutics are Nux vomica. So bleeding is associated with the hemorrhoids and after overuse of the stimulant or the alcohol. Second, that is the sulfur, recurrent bleeding, early morning diarrhea and the hemorrhoids. And the last one, that is the carbovage, that is the collapse stage, cold extremities, air hunger, flatulence with the bleeding. So these are the different homeopathic therapeutics which are used to treat the uh, upper GI bleeding as well as into the lower GI bleeding, right? So, my friends, thank you very much. I hope you can easily understand which are the different objectives of the upper GI bleeding and the lower GI bleeding. Uh, so, if you have found any difficulty or any query, please comment, and you can contact me. Once again, thank you very much.